We're back live with Dr. Barbara Ferrer. A question, hopefully quickly, about the economic impact of some of the decisions that have been made. There are folks, especially in the restaurant industry, who are really frustrated by the decisions that were made in terms of stopping outdoor dining. Now that we have had more time and more data, and we have been dining outside for some time now, is there specific evidence, do you think, that shows that outdoor dining was a major source of spread? And what do you say to people who are frustrated by that decision, who maybe had to shut down their restaurant because of it?
Yeah, thanks. And first, you know, I'm deeply aware of the heartache that many of the public health decisions wrought on so many people who live and work here in LA County. And, you know, my wish is that we had had a much stronger safety net. Nobody should ever have to choose between being safe and following public health directives and their livelihoods. And if we had had a stronger safety net, that shouldn't have been the choice. I do think that there's been ample evidence, and you know, including a recent study that was released by the Centers for Disease Control, that in fact dining outdoors and indoors and not wearing face coverings increase the number of people who become positive, who end up in the hospital, and unfortunately who end up dying. So I think that evidence continues to mount. And I do want to note, a week after we made the decision that actually said, you know, we're getting in the middle of a big surge, and things are really going in the wrong direction here in LA County, the state also followed with a similar ban on outdoor dining, as did other places across the country. You know, we had hundreds and hundreds and hundreds of people dying every single day. You know, we doubled the number of people that were dying in a few weeks. Right. And our case numbers were over 15,000 every single day for days on end. So we really had to stop transmission as much as we could, wherever we could. And every place that people are gathering where they're not wearing their face coverings and they're with people who aren't in their household is a risk.
And the good news is we're fewer than 400 cases on average a day. And ever since, we're now in the orange tier, but ever since entering the red tier, the numbers have not gone up despite indoor dining and that happening. So that's good. Okay. We want to know a little bit more about you. Tell us something about Dr. Barbara Ferrer that we don't know. What is a misconception, perhaps?
I'm not really sure, because, you know, I'm a fairly private person, so, and I'm not really sure, you know, what folks often think about me. You know, I think, you know, perhaps one of the misconceptions is, you know, where I've, you know, what do I really like to do? You know, what are my passions? You know, what else besides, you know, working at a public health department fascinates me.
And what are they?
You know, some people do know, you know, I started my career as a community organizer, and I feel like I learned more as a community organizer than in any of the, you know, educational opportunities I've had, because it's so important to be able to listen to people and to really understand what their perspective is, and also to be able to listen because often people who are the closest to the challenges are going to give you the best solutions to those challenges.
Thank you very much, Dr. Barbara Ferrer. We appreciate it.
Thank you.
Thank you.
We'll be right back.